Hi, everybody, and welcome to this really powerful and informative discussion about pain. We're going to talk about what pain is. What are the contributors to our pain experience, this universal thing that we all share? And then what are evidence-based strategies to resolve pain that don't involve surgery or medications or injections? I'm Dr. Lisa. I'm a physical therapist and a specialist in osteoporosis, exercise, and education. And today I'm so honored to have this discussion with my friend and colleague and mentor, Dr. Sharna Prasad, physical therapist. Welcome, Sharna.
Well, thank you, Lisa, for having me here on your platform. I appreciate it.
Well, I'm so glad you're here. So let me give you the honor of the introduction that you deserve. So Dr. Prasad is a physical therapist. She got her DPT from the International Spine and Pain Institute. She has 500 plus hours in as a therapeutic pain specialist. She is trained in acceptance and commitment therapy, and she's a diplomat of the Association of Lifestyle Medicine. Is that correct? Did I say that right? Yes. Fantastic. And Dr. Sharna is a mentor of mine. In my personal experience of chronic pain in my late 30s and early 40s, I had a herniated disc in my neck. I had pain down my arm and weakness. I had degenerative disc disease that was severe in my low back with bone on bone, all these scary terms. And I had parents who'd had back surgery and were on disability. And I thought that was my future. I was certain of it, as a matter of fact, based on the training that I had initially. But as I began to explore and search and learn about pain and pain neuroscience and attended one of your fabulous continuing education courses, it changed my life. It resolved my pain, and it changed how I approached pain with all of my clients. It was one of the best experience I ever had as a physical therapist. So I thank you, and I would love for you to share with the audience how you got to do this very, very special kind of work that you do now.
Well, thank you, Lisa, for your kind introduction and kind words. It was a very meaningful training that we had done. It was, from your heart. When you learn something, you just want to share it with the world, right? So I've had chronic pain myself, 2013, 2015, for 2 years, crawling out of bed, going to the gym, going to work, burnt out, just didn't know what to do with my pain, with my biomechanical training that I had was very limited in what I could do with my back. And it was very frustrating. I was scared that this was going to be the end of my life. I was going to be in pain for the rest of my life. And that's when I got introduced to the science of pain by a physician, Dr. Kevin Cuccaro, who was an anesthesiologist and a pain specialist, and he wasn't doing any interventions or any treatments. He was teaching healthcare providers, and I was like, what is he doing? And that's when I got curious about what he was talking about. And that changed my pain, and that got me very excited. Actually, my pain changed in 6 months, and I was very surprised, very, very surprised. And I was so grateful that I needed to share this with my community of my patients and my colleagues and everybody else. And that was what you're talking about. You attended. And that is where this journey started. And there has been no end to it, right? Actually, to tell you the truth, it's been very, very rewarding to be in this space after 38 years of being in practice, that we don't feel burnt out and we feel like, oh my God, we're so charged up. How can we help pivot patients?
Yeah, so powerful. So this came from a very personal experience of learning these tools and how it was expressed in your life. And when you, it's so gratifying as a professional when you have things that can really help people. And yeah, that just fuels you, right? That's just such motivation and passion of what you do. Let's help, because it's such a complex topic. Let's break it down. You're such a wonderful teacher. Can you talk about what is pain?
That's a very good question, because I don't need to define it. There is so much evidence behind it. The International Association of the Study of Pain has defined it for us. So pain is a sensory and emotional experience. And we're going to put a full stop after that. So you don't go there's another part of the definition, but if you just stick to that, we'll be good. But I'm going to tell you the whole definition. Pain is a sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So in lay terms, what it means is you can have actual tissue damage, or you can have potential tissue damage, but your pain is sensory and emotional in nature. So let's break it down. So what does the word sensory mean? Right? We've got our 5 senses, our vision, our smell, our taste, our hearing, our touch, and proprioception, which you have talked a lot about in your practice, vestibular, and the interoception, which is the internal sensations in our body, that inner senses that tell us, oh, we're hungry, we're thirsty, there's a cramp in my stomach, my heart's beating really fast, I'm a little anxious, all, not the anxious part, but the beating part. Those are interoception. So that's your sensory experience. So people in pain, what do they experience? In sensation, my body, my back is throbbing, pulsating, stabbing, hot, cold. Yeah, go ahead and add.
Tight,
pulling.
Yeah.
All those words are sensory words, right? Then the emotional part is, what are the emotions you feel when you're in pain? Right?
Yes, this is huge.
Frustration, fear. Big one for me was fear. I thought I had cancer, but I was so scared to see the doctor because the doctor would verify that it was cancer. So I sat with myself in fear for 2 years.
Yes. You start to think about the future and how it's changed. In your present experience, your future looks completely different.
Exactly.
Yeah.
And the frustration, that helplessness feeling. I'm the physical therapist. Who's going to tell me anything more? I know everything. It was such a, like that ego of yours, like know everything, and then you realize you know nothing. And that was such a big realization after so many years of being in practice. It was just kind of brought you down to your knees, and then you rise again. But so coming back to the emotional is the frustration, the anxiety, the helplessness, the hopelessness, the all those, and it's an experience. So if all of us had a T12 compression fracture, would all of us have the same experience of pain? No.
No, it'd be different for everybody.
Unique experience.
Yes. See, and it depends. What is your work? How does it affect your vocation? How does it affect your relationship with your family and your loved ones? How does it impact your potential to earn? How does it affect your sleep and your ability to eat and your appetite? It's all encompassing, and it can be different for every person in every circumstance.
Exactly. And so it's a unique pain story each one of us brings to the table. And then that's why the treatment also becomes very unique. And then once you figure that out, that, these are the different pieces that are there, then you can solve the puzzle very easily. And that is what I enjoy the most. Is I don't like 20-piece puzzles. They're very boring. It's too easy for me. I like the 1,000-piece puzzles. You bring it on. I love that. I do one every year around Christmas. My daughter and I, we put 1,000 pieces. But that's what I enjoy the most.
Wonderful. So then breaking it down, this pain isn't just sensory or physical, but it's physical and emotional. They go together. We can't separate them. Our mind and body are connected. And that's part of each person's unique experience of pain. And one of the things I remember from your teaching and lectures that I love, and it's been so helpful for me, is just really validating. All pain is real and all pain is protection, right? Do you agree?
Yeah.
Yes. So really, we want to acknowledge and validate everyone's experience as it is, as they say it is.
Exactly. All pain is pain. So
all pain is pain.
All pain is pain. So there are multiple contributors to your pain experience. So all pain is pain. So social pain, emotional pain, psychological pain, it's all pain.
Yes.
All pain is pain. All pain is real. At no time are we saying that your pain is not real. But we're explaining complex neuroscience in this process. So sometimes people say, oh, you're trying to tell us it's in your brain. No, it's not. I mean, the brain is playing a big role in it, but it's not that your pain's in your head. Your pain is very real.
Yeah.
And,
What's important is to know that they're not separate.
no, they're not.
Separate.
They're
Yeah.
not. Your body and mind, and the word mind body, even that is got polarity. That there's a mind and there is no such thing. It's just your body which has the mind in it.
Yes, exactly.
It's all part of one thing.
So, do you want to talk a little bit about contributors? And I like this word contributors when we talk about a pain experience. People like to say the word cause, is like they want to pinpoint the one thing, but it's never really one thing, is it?
No, it never is. And that was again Dr. Kokara's gift to me when I would write things to him in email about pain and he would correct it for me. And that was one thing he said, that it's not about the causes of pain, it's the contributors to pain. And I was like, whoa, that's like a mind shift. So and that helps a lot. So then, is it okay if I share an analogy that I like?
Please.
So I'm a gardener and I love plants and nature and everything else about the Mother Earth. So if you take a tree, the analogy of a tree, what does the tree need to thrive? Go ahead, Lisa.
They need sunlight, water, nutrients, air, oxygen.
Yes, absolutely. Yes. So you need the soil, water, the sunlight, and the environment. Is the plant next out where the deer can get it? Are there gophers over there? Is it getting too much sun? Everything, all that contributes. So the soil is the sensations, right? Any plant, you get a free plant. The gardeners will tell you it's the soil. It's all in the soil. The soil is the most important part of gardening. One of the most important parts. They're all important. But so the body sensation is your data. Your body is giving you data at all times that, okay, this is what's happening. And the other thing is the soil, just like the soil is always changing, similarly, your sensations are constantly changing. Right? Because your sensation is constantly changing, the pain is a combination of your sensations and emotions and your thoughts and everything. But if you take the data from your sensations, you will find out that your sensations are constantly changing. And that we can talk about that later on. But right now, I think that's enough for this analogy, that sensations and the emotions are as the water. So if you think of it, the word emotion is the energy of motion, right? So it's always moving. Again, emotions also, and water is always moving. It has no shape. It can go wherever it wants to go. And the thoughts and beliefs. Yeah, what are the thoughts and beliefs? I'm never going to get better. This is my story. I'm going to be like this for the rest of my life. And I've seen in your group chats how people have started changing their thoughts and beliefs around osteoporosis. It's so rewarding and so gratifying to see people feeling empowered. Right? Yes. This is my body. My DEXA scan is changing. Oh my God, I love reading your posts of your people who are on your Facebook group and how they share all that.
Yeah, that is really powerful in that change of mindset, because our body hears our thoughts and words and worries and concerns, and it's difficult because the feelings are really valid, but to be able to recognize the opportunities that can exist in that experience can completely change how it feels, not only in our mind but in our body.
Yeah, and the other part was environment, right? The environment. So for pain, the environment is your relationships, your spouse, I had a patient that would get in the car and she'd say, I do fine all day while I'm at work, but as soon as I get in the car and get home, I hit this traffic light and my pain starts. And then we dug in a little bit, and then if she was going through a divorce and, she was very lonely, and, all that complex pieces come out. So your body is not broken necessarily in chronic pain.
Mm.
That's the part, but your pain is very real.
Yeah, that's interesting. So that's part of that puzzle, that trying to work through all the layers of contributors when you're working with a client. One of the things that can happen and the clients that I work with who have osteoporosis is they can experience a fracture, and very often it's a vertebral fracture. And some people will go through that fracture and they'll have their pain in the beginning, and then the fracture heals, and then they don't have pain. And some people will experience that and they will have pain that lingers long after the fracture has healed. Can you talk a little bit about that, or perhaps you have a patient experience that you can share that may shed a little light on what that's about?
Absolutely. So I had a patient who was in her mid-30s, had a vertebral fracture when she was sneezing. And she was 7 months pregnant. She went through the childbirth, and she came back to me when she had a newborn baby, like I think about 2 or 3 months the baby was, and she was so scared to hold the baby because she was afraid that she was going to fracture her spine again. And again, we went through the whole process of the physical therapy part, which I think you have addressed that beautifully. The posture, the strengthening, the balance, and the power, the power. So we went through the traditional PT aspect of it, but it was her thoughts that, how am I not going to injure my back again? She's very young. So, and I could not guarantee that, but I could tell her that as you get stronger, your body is so resilient, right? Our body is so resilient. And we've seen it through our stories and all our patients that our body knows how to heal, but we have to give it permission to heal. So she started understanding that. And I explained to her the fracture there. Once the callus has formed, it becomes a really strong part because the body knows how to strengthen that, right? So now it is, how do you maintain your posture? How do you maintain your strength? How do you maintain your agility so that you can be the mother you want to be for this child? And she turned it around because it was fear that kept coming and showing up for her. So we taught her how does fear show up in your body, and how do you accept that and move on from that?
Yes, because fear can result in muscle tension and tightness and avoidance of movement. And we know that oftentimes movement is what helps our joints to feel better. And it's helping to reframe the context of safety. And like you say, safety is nothing any of us can guarantee to anyone, but reframing how we approach things to create a sense of safety in our bodies. And that's why I love teaching the right type of exercise and the right type of movement to help create that sense of safety and control. And then that really can help transform that fear, right?
Yeah. And the other piece that comes from ACT, acceptance and commitment therapy, is values. Why do you want to get better? Why is it important for you to get better? Once you know your why, that, I value, authenticity. I value that I want to be a strong role model for my child. So once that comes in, then the goals become very easy because they're value driven. The values are driving the goals. So you don't need to work so hard on the goals anymore because the values are direction, the goals are destination. So, we can get to different destinations, but the values show you the direction where you want to go. So it makes a big difference. Yeah.
Okay. So can you explain a little bit why the process of acute pain resolving, and maybe what are contributors that people could consider for pain that lasts more than 12 weeks per se?
So that I just did a video on that, but and you're welcome to. I just started my YouTube channel, so very few subscribers and whatnot. But feel free to. I've explained this in detail over there. But what it is if you look, we lean into the science of the physiology, right? Just bone physiology. So you break a femur, like your biggest bone, you break it. It takes 8 to 12 weeks for the healing process, for the callus formation to happen. So the bone has healed, but your pain can persist for years, right? Like sometimes we see patients for 10, 15 years, the pain is there. So the tissue has healed, the bone has healed, but the pain has not. So
Right.
you see the difference? The tissue damage. So in acute pain, you have nociception, which is the danger signals that are coming from the area that's broken to the brain, and the brain is saying, "Yep, that is danger. You just broke your femur. You have danger." So there is a lot of pain over there, right? And then when the healing is over, the brain still says, "No, it's not safe, because what if it's not healed completely?" Well, it's 10 years post breaking your bone. It has to have healed. But no, I have a broken leg. And people still say that to you. When you come and tell you the story, "I have a broken back. When did you break your back?" "When I was 7 years old. I fell off the monkey bar and I have a broken back." Well, you're 67, right? That's 60 years post. So it's how we get stuck in our stories. So the acute pain has more of the nociceptive input, whereas in chronic pain, it becomes all the other factors that are contributing to the pain more. In acute pain also, you have these thoughts and emotions and sensations also contributing. So acute pain and chronic pain are not that different from the experience standpoint, if you're looking at the whole picture from the tree analogy. But in acute, you have more of the nociceptive input, because pain is an output of the brain, not necessarily the input. You see? So that makes it a little bit different. I mean, so you can see the difference between the acute and chronic.
Yeah. So how we talk about the healing process and the fears and the worries about, to me, I see a big restriction in movement. So for oftentimes movement patterns become really different and changed. And we have to, in a sense, in my analogy, is kind of rewire the brain to build safety into the movements in small steps, small incremental steps to help kind of change the pattern associated with movement, to give people that movement confidence. That's what I like to teach them, is giving them movement confidence. Is there a way that you do that? Well, yeah, you nodding your head, right?
Absolutely. I mean, it's all about movement, right? It is, because if you look at it from an emotional standpoint, I was moved by that story. There is movement in that. There is physical movement, right? So as physical therapists, we are considered movement experts. So the movement is emotional, as like we said, the energy of motion, right? So it's the emotional movement and the physical movement. So if we can help our patients with both, then, the sky's the limit. There is absolutely no stopping. Because you're there for them in both aspects.
Yeah. I want to kind of step back to a word you mentioned called nociception or nocebo. And I did a video recently about nocebo, because I think the language that we use as people in the medical community is so powerful on how our clients and guests and patients receive it, and what it can do in their pain experience. And nocebo is that, when we hear terms like degeneration or severe and bulge and when we hear these terms, it really can have a very negative downstream effect on how our brain integrates that into our body, into our movement, into our practice. So nocebo, I love all the ways you're using these very empowering terms and talking about our thoughts and perceptions. And I know you and I are both incredibly mindful about how we share this type of information, because we don't want people to receive a message that makes them feel more fragile or more vulnerable, when it may not be. And sometimes it is accurate, but most of the time it's not. Do you have any examples or patient stories about people that may have had things that they felt contributed to their pain experience, and they thought maybe it was hopeless, but where you had a success story?
Well, favorite story, and I'm going to give you two quick stories. So one was this gentleman, a from the VA, very tough guy with back pain. And we were working on some exercises. And in the middle of the exercise, he says, I do these things and my pain starts barking at me. And I said, and I didn't say much. And then a few minutes later, I said, tell me about this dog in your life. And he just took off. He was like, and he just looked at me surprised that how did I know that that there was a dog in his life? And he started telling me about this Chihuahua, his wife's Chihuahua, that constantly is barking all the time. And all his wife does is pays attention to this Chihuahua and doesn't care that I am in so much pain and this and that. And it was just, he just took off. So what I'm saying is that when patients are describing their pain, they're using words, and those words have power. I mean, you talked about providers using words that can be damaging, but I'm talking providers listening to words that patients are saying and how that can change it around and how they can understand that how this Chihuahua is contributing to, not to say that he didn't have a back surgery and didn't have back pain. I'm not saying that that's been minimized, but there is that other part that this Chihuahua is contributing to that pain experience.
Interesting.
Yeah. So I'm going to tell you another one really quickly. This guy came to me, older guy, just retired, was with spinal stenosis. And we went through, I was asking him, I said, so tell me, what do you understand by spinal stenosis? And he said, my spinal canal is narrowing and it's going to press on my nerves and I'm going to be paralyzed. And I said, tell me more. And he said, I'm going to be paralyzed and end up in a wheelchair like my mom in a nursing home and be lonely. And it was just touching, it just touched your heart. And I said, what do you want to do? It's like, well, I'm a woodworker. I'm a carpenter. I like to make furniture and stuff like that. But he wasn't able to do any of that. So I examined him, got him on the floor, got him to stand up, did all that. And we came up with a plan. Oh, you're going to walk to the workshop. That's your goal. And that was his goal. So he came back home. He came back a week later. And then I explained this tree analogy, thoughts and emotions and all that. And he came back and he said, Sharna, I have no pain. This guy's had pain for like 5-6 years. And he said, like, I have no pain. And I said, well, tell me more. What happened? He said, I went home. I talked to my wife about what you had said. And I said, she was saying about emotions and all these things. And my wife was like, yeah, good. Because, you never talk about emotions. So that's a good thing. We need to talk. And that same evening, my friends came over and they said, she didn't touch you. She didn't do any manual therapy. You shouldn't go back to her. Find another therapist. But I figured I'll just do what you had told me. I walked to the workshop, turned on the machines, next day cut some wood. And by the end of the week, I made my picnic tables, and I've already made 2, and I put, on Craigslist to make more and all that. And I was like, wow. So I was like, Sharna, talk. Flare up, relapse. So we talked about it. And then I said, okay, let's just follow up in a month. There's no point in seeing you right now because you're doing so well. We'll come back. Because a very strong person, also very strong physically, moving really well. He was a no-show. And then I called him. I said, hey, what? You're a no-show. And he said, I am loading sheetrock right now. I don't need therapy. I am doing well. So the point is, sometimes you just need 1 or 2 pivotal, I call it pivotal sessions, and they're on their way. Your intervention is over. You don't need to be involved.
You help with education and creating a new understanding and helping people recognizing tools that are within their power and control and giving them simple steps to move in the direction of their values and their goals, right?
Exactly.
Yeah.
Exactly.
Yeah. And it's just reframing. It's just helping you really do a great job of helping people reframe that experience. What is exactly happening? What are the contributors? And you are able to tease out the cue words that they're sharing with you that may be a key component of what's happening, that they can look at that with a different set of lenses. And the results with which is really different than traditional PT and do this press up or do this specific back program. It's a really different approach that really puts control into the client to do what makes sense and fits for them based on their goals. I love it.
Yeah, it's more than reframing. I think what I have from my acceptance training, what it has helped me learn is helping them accept their pain or accept their situation where they are. And the word acceptance is a hard one because, but it's like a beach ball, right? If you take a beach ball and you keep pushing it in the water, right? What's that beach ball going to do? It's going to come right back up.
Yeah.
So, and that's the part I have, I'm big on, that it's a beach ball. This is your pain. We're going to just keep it close to us, walk around with it, and try and understand all the other science and see what happens to this beach ball. And, you might find that the beach ball is still there, but you can see the world, see what you value, see what's important to you in your life. And you're able to see that in a better perspective than just we caught up in this pain, mess that we feel like we are in,
Yeah.
Anything beyond it. I mean, you and I both know how that goes. Yeah.
I love that. That reminds me of some education and training I've had in mindfulness, where we recognize the experience of grasping or holding on to a pleasant experience or resisting or pushing away a negative one instead of just being with the experience. And eliminating that struggle is incredibly transformative. And it is difficult. It isn't an easy concept. But when we stop pushing things away or trying to pull things towards us, it can totally give us the moment to be present. This precious, sacred moment, the present moment. It's all we have, right?
Yeah.
Well, this has been wonderful, and I really appreciate your time and sharing your expertise with the viewers. And if they have questions for you about pain, or if they're interested in working with you, what's the best way for them to get a hold of you?
So I am following your footsteps really closely. I have started making some YouTube videos. I also have a Facebook group. They're all under Dr. Sharna Prasad. And I also have a website. It's called Solace, SOL4CE. And the word is to bring solace to our communities, but it's also soul force, which is, increasing your soul's force. It's like, how do we light that fire inside you so that you light up and you take on the world? So that's the way I see it. I also see people as they get better, they're like a pebble that falls in a lake and they create a ripple. So they're taking care of their health, but they're also influencing their immediate family and their communities. And, so that is really important to me. It's not just about you getting better, but how are you going to be giving back to the community? And so you can reach me at Solace and schedule a 15-minute free screening with me, and we can just chat and see if you're the right combination of coaching and patient or client, I would say. And then I also do group classes, which is, I've been doing it for 8 years in where I used to work, but now I am ready to do it online. So I am gauging the response of how people are interested in pain, because what it is communities heal communities. So we need a community to heal together. And I like these micro communities where we lean on each other and support each other as we go together in that. So I'm doing one in Corvallis, starting in my town, in person on April 23rd. But if the online people are interested, I'm just gauging and seeing if we can have a group, and then we can do it online. It's very powerful. In small groups, so 10 to 15 people at the most. And I give them a curriculum that they work on themselves. And the group generates a list of questions they have on pain. So it's very customized to the group. And then we work on each question that they have and present the science, present the articles, and give them evidence to help them pivot.
That sounds fabulous, like a fabulous opportunity. Well, thank you for sharing that. Thank you for joining me, and perhaps we'll have more discussions in the future.
I am looking forward to it, Lisa. I am looking forward
Wonderful.
to it.
Thank you so
Thank,
much.
thank you very much for this honor and opportunity.